We know that there are currently millions of people who are behind on rent. The New York Times estimated that the average person who's behind on rent is behind by almost $4,000. And most Americans didn't have enough emergency savings before the economy shut down and people started getting sick. So the federal moratorium was really quite essential to not just keeping people in their homes for the sake of keeping people in their homes, but we know that evictions and foreclosures, by forcing people to move under duress, accelerates the problems of the pandemic by disrupting employment and education further, but also forcing people into more crowded and therefore more contagious environments.
Good evening. I'm Susan Spurlock, Executive Director of Ford Hall Forum at Suffolk University, and I'm delighted to welcome you to our virtual space for this evening's program, Getting the Word Out, the Economics of the Pandemic Disruption. It's now my pleasure to introduce Christina Coolidge, who is a faculty member in the Political Science and Legal Studies Department at Suffolk University. Christina, the floor is yours.
Thank you, Susan, and welcome everyone to the fourth episode of our second bite at the apple of examining the politics of global pandemic. So tonight's topic, as you heard from Susan already, is going to be a very large one, and we're going to look at it from a number of different angles, but certainly the state of the economy and how COVID pandemic has impacted all of us through our workplaces and through how we live our lives and how we're now thinking about how we may want to return to work or not are all giant questions. So we want to hear from you, ask your questions, we want to hear your experience, and we also want to hear from our fabulous panel who will help us unpack some of the very big questions, such as how much has the pandemic changed the fundamentals of the economy? Are we just going to go back to normal? Or have there been seismic shifts? We do know, we were talking about this a year ago, that the COVID crisis has undoubtedly ripped the Band-Aid off a lot of things that we weren't paying much attention to before. And now we are. The question is, will we still be doing that 6 months from now or 10 months from now? So some of the big questions are hopefully what we're going to address today. And I'm also hoping that we're going to leave here with you being more curious about what's going to happen and having a lot more questions. So I'm going to throw this with no further ado to our fabulous moderator, Mabel Jong. Mabel, please take over.
Thank you. Thank you so much. I am so pleased to be here and to have with me three panelists. Dr. Kristen Broady is a fellow at the Brookings Metropolitan Policy Program and has written about preparing U.S. workers for a post-COVID economy. Michael Ettlinger is founding director at the University of New Hampshire Carsey School of Public Policy. He's looked extensively at unemployment increases and GDP declines due to COVID. And Jacob Faber is here. He's an associate professor of sociology and public service at New York University, researching the impact of the pandemic on declining rental prices in diverse neighborhoods. Welcome. Welcome to you all. It's great to see you. Now, after suffering the worst downturn since World War II, the US economy is bigger than it was pre-pandemic, a recovery the likes of which had not been seen since 2017. But COVID is still a wild card that could shape the course of where things head next. Let's talk about what we know about the recovery so far. Dr. Broady, you're a fellow at Brookings Institute. Recent data tells us that the economy grew at 6.4% in the first 3 months of this year. That sounds pretty solid. But upon closer inspection, the recovery appears to be uneven across racial lines. Tell us more about the numbers.
So I'm so happy that you asked that question. And anytime I'm talking about unemployment or the economy, I always want to disaggregate by race, gender, and age. And so if you look at the unemployment rate over the last 13 months, you would see that for African American women, the unemployment rate has been around 2.3 percentage points higher than the rate for the US overall, and around the same or a little bit higher for Hispanic women, and much higher for Black youth 16 to 19 years old. So like in this last month with this last jobs report, we saw that the rate for African Americans was like 9%, right? And if you looked at for African American men, it was like 10.2%. So to say that the unemployment rate has gone down or that we're in this recovery is true overall. But as we think about people who need help or who need services, we need to see who they are and what the numbers are for them. And the only way to do that is to disaggregate those numbers.
Right, right. It's just astounding. The COVID-19 pandemic and related shutdowns have led to the highest unemployment rate nationwide since the Great Depression nearly a century ago. And I want to bring in a question from an audience member that we got early on. Mary Ann Bohart asks, why did it take a worldwide pandemic to reveal many economic disparities that were present all along? Dr. Broady, could you take that?
I think I would say that I would ask reveal to who, right? Because as I looked at my CV the other day, I've been writing about racial disparities in healthcare and employment in housing since 2009, right? And others have been writing about it for much longer. William Sandy Darity was writing about the racial wealth gap. His seminal paper sort of started that conversation 5 years before I was born. So yes, the pandemic, was a really big shock. It wiped out 113 straight months of job growth, with total non-farm employment falling by 20.5 million jobs in April. So of course, the 2007 to 2008 housing crisis affected people who owned houses, right, and trickled down into other sectors of the economy, but never before, or at least not since the previous pandemic back in 1918, I guess, had we seen something that shut down the world economy in the way COVID did. But to say that it revealed any sort of inequality, I would have to ask to whom.
Okay. Well, governments, you mentioned, they turn to proven public health measures such as social distancing to physically disrupt the contagion, yet doing so severed the flow of goods and people, stalled economies. Economic contagion spread as fast as the disease itself. Professor Michael Ettlinger of the New Hampshire Carsey School of Public Policy, please tell us about the specific government policies that shape the economic response to COVID.
Yeah, and I just, before I do that, I just want to chime in on that last question a little bit, which, I think I'm older than I know I'm older than both the other panelists. And let me just say, it's no secret these disparities and inequalities that have existed for a long time. And that, what's happened is there are things that have happened, not just the pandemic, that have sort of elevated attention to them, but attention's been elevated before. And, I just think the big question is whether, a year from now, we're still paying all the attention we are to it now, or we're sort of like in the past, where it's sort of like ebbs and flows in terms of how broad and intense the attention is. So I just wanted to, make that point.
I think I would just add to that, it's not just the pandemic, but if you think about the racial sort of uprising surrounding George Floyd and Breonna Taylor, and that those protests happening in the middle of a pandemic, right? It's not as if Rodney King's beating didn't happen. Of course it did. It didn't happen in the midst of a pandemic though, right? Like we've seen Black people be killed or beaten on camera, but in the middle of a pandemic, not so much. So it was a confluence of circumstances that brought this to bear. And it means that people like myself are here, that this panel is happening, and that we've been saying these things for my whole career and generations of careers before mine. But through this confluence of circumstances, we're being heard louder and more broadly than we were before.
Right.
Mhm.
Yeah.
So, go ahead, Professor Ettlinger, go ahead.
I was going to answer your question for me, if I should do that. Yeah, in terms of the government response, I mean, I think, there was a very large federal government response, and it was both to help businesses and to help people. And anytime you sort of try to help out businesses, it's tricky because there's some businesses that really need the help, some don't. You're trying to do it really fast, and it's hard to get right. And I do think there were definitely flaws in the early response. It was just kind of a big effort, and some of it misfired. I do think it got better and better. It never got perfect, but it did get better. And then in terms of people, I just think that it's important to remember that, like, we did have this historic drop in employment, but we did not see the levels of deprivation that we saw in the Great Depression. I mean, as bad as it got, the enormous sums of money that the federal government was pumping in to help people, really avoided a lot of struggle. And I'd also say that it also teed us up better for a recovery, because we're not in a situation, there are certainly people who've been economically devastated by this and have a very hard time, but it's not nearly as widespread as it would have been. So we don't have people just trying to dig out from economic, devastation that we would have had without that kind of help, and just dragging down the economy with people just trying to get by. So, I mean, there are people in that situation, but it is much less bad than it might have been.
Okay, so there's nothing you would have changed. Our next question from the audience.
Well, no,
she wants to know, Dakota Wilson wants to know, what would have been a better first step to mitigate the impact?
The better first step would have been handling the pandemic better, okay? So, I mean, the better first step would have been us sort of not, dropping the ball when it first hit this country, and doing what other countries did, and not having COVID be as rampant as it ended up being. I mean, that would have been better first step number one. And other than that, I would say that, look, the other thing I would say is that one of the problems we have when we hit these crises is that we're not prepared for them. There's a technical term, automatic stabilizers, which basically means you have law in place. So when things happen, the provisions are already in place, and we're not on the fly. Everything's going down the tubes, and we're like, oh my God, we got to bump unemployment insurance, and we have this messed up unemployment insurance system. And oh my God, we got to figure out how to get money in people's pockets. And how do we get money to small businesses without leaving out the smallest small businesses in underserved communities? All of a sudden we're like, oh, and what we could have done was been better prepared. And there was talk about that after the Great Recession, and we're going to do it better, and it didn't happen. And I sure hope we do it this time, so that next time something happens, we're better prepared. So it's easy. You can pick at the things that were done, but what we really needed was to be better prepared for something like this happening. I'll just say one other thing. The other thing that would have been different is we also, the help kind of went in stops and starts, which and because it's sort of, the first batch of support would come through, and then there'd be a delay, just because there wasn't anything sort of automatic and built in. And that was, more people experienced more pain, more businesses went under than were necessary because of those things.
Well, to stem some of the pain, one of the public policies put into motion was the federal eviction moratorium, which did expire over the weekend, but was just extended on appeal by the CDC. Jacob Faber of NYU, how many people did that policy impact, and did it do what it needed to?
That's a really great question. I think that it's to be determined how many people that the policy has impacted. And we know that there are currently millions of people who are behind on rent. The New York Times estimated that the average person who's behind on rent is behind by almost $4,000. And most Americans didn't have enough emergency savings before the economy shut down and people started getting sick. So the federal moratorium was really quite essential to not just keeping people in their homes for the sake of keeping people in their homes, but we know that evictions and foreclosures, by forcing people to move under duress, accelerates the problems of the pandemic by disrupting employment and education further, but also forcing people into more crowded and therefore more contagious environments. And I am thankful that the moratorium got extended today. Breaking news today, it's really great. There were still a number of problems with the moratorium and its relationship to the parallel rental assistance program. There was a lot of confusion today on the state and local level about implementation of the now extension. Were people who were evicted between Saturday and today? Do those evictions stand? We don't know the answer to all these questions, and we know that not all kind of landlords are participating in the rental assistance program. The rental assistance is coming out way too slowly in most parts of the country because of a number of bureaucratic barriers keeping the money out of people's hands. So we still have this enormous backlog of rent owed, and it's unclear if or when the aid will catch up. And the Princeton Eviction Lab has estimated that even since the moratorium started, that there are hundreds of thousands of evictions that were initiated across the country. And echoing a sentiment that Dr. Broady brought up earlier, all of this is concentrated in communities of color, where there are going to be devastating impacts on individuals and families, but also neighborhood level like spillover effects of vacancy and housing instability that can slow economic activity and again exacerbate the kind of direct effects of the coronavirus, which unfortunately is getting more contagious and more deadly over time.
Right. Now, Professor Ettlinger mentioned this. Congress passed around $4 trillion in spending over the last year to respond to the pandemic. A lot of people got stimulus money that was greater than what they earned. So why didn't this help, or why didn't this rescue people from falling behind on the rent?
Well, we know that it did help, that the stimulus delivery helped millions of people avoid the kind of devastation that Dr. Ettlinger mentioned earlier. And we know that we've known for decades that paying people money keeps them out of poverty. It's not a surprise. And so the stimulus was extremely effective at keeping people at least moderately financially stable. And we know that the expansion of the social safety net that was part of the stimulus as well, it's unfortunately only temporary, is estimated to have child poverty in the United States, which is a really amazing accomplishment. But to come back to your question about what is enough, there's still this even if you were making more via the enhanced unemployment benefits than you were prior to the pandemic, that the fact that Dr. Ettlinger mentioned that the stimulus came in these kind of fits and starts, that there were gaps in income and cash flow in households, that there's still millions of households that have this debt, this rental debt that's backed up due to no fault of their own. And again, it's unclear whether the direct stimulus or the housing assistance will be able to make up that gap.
And there is the theory that the stimulus money is keeping people from finding jobs. I want to unpack that a little bit, but also as economies reopen, labor shortages are still worsening. The numbers.
Yeah, I mean, I would argue that low wages are keeping people out of jobs, and not the stimulus, which, if you actually calculate it as an annual income, is quite low. And I have a little bit of, I know that the kind of common way to evaluate employment and unemployment programs is, whether or not people are working and how much they're making. But, we're in a pandemic. Like, to go back to a question that you asked Dr. Ettlinger earlier, one of the things that I would have changed is, in the midst of a pandemic, we should be thinking about paying people to stay home. That the kind of weakness of our social safety net and the inadequacy of our immediate response meant that millions of people who have jobs that we all of a sudden started calling essential, who are disproportionately poor and people of color and women, were compelled to work in incredibly dangerous conditions before we knew anything about masks, the efficacy of social distancing, of course, well before we had vaccines. So I think that the kind of calculation of whether or not people are in the workforce is far more nuanced in the situation where being in the workforce is a danger, not just to yourself, but to your family and your community.
Okay, I want to bring Dr. Broady in on this as well, because at the same time, we did see companies hasten their automation efforts to create contactless environments to the detriment of workers. Is that right, Dr. Broady?
So I agree with most of what you just said, Dr. Faber. The only thing that I want to push back on is that we didn't know, right? So I spent 5 weeks in Suzhou, China in the summer of 2019. And when I first started telling my friends, because I was on WhatsApp, and before they started shutting people in China down, they were saying that, 500,000 people had it. That's not a number that ever got reported publicly. But if I'm hearing it, people in the US government were hearing it, right? That we needed masks, that they were cremating people around the clock, that there was a cloud of pollution. And this may sound like, rhetoric or fake news or a conspiracy theory, but we know now that it wasn't, right?
Okay.
So I think if I heard those things, I was telling my friends in January, you need to get some Lysol, you need to get some more Dawn, you need to get a deep freezer. If I knew that as an economics professor, then US government knew it. That's number one. I think two, we were not prepared in terms of masks and other things. So in the beginning, the CDC told people that they didn't need to wear masks. Right. And I argued with one of my friends who said the CDC said we don't need masks, that it's not airborne. It's not, all of these things that we know for sure it was. So I think there's a difference between not having enough resources and not knowing and not informing. So let me just start there. I agree with literally everything else you said. I think the second part is there's this connection now with COVID and diabetes, that I'm not a medical doctor. I don't know which way it goes, but something about COVID affecting people who have diabetes or triggering some type of circle there.
Yes.
And so we know that African Americans and people who are overweight or obese are more likely to have diabetes. So some of the ways that COVID has affected certain populations in the US is because of racism in healthcare and how we've treated people. But I know that you want to talk about automation, so I'm gonna go to that.
Yeah, and Professor Ettlinger, sorry, I've got to bring you in on this as well, because you've written about this. But Dr. Broady, go ahead and talk about what we've been seeing with the automation and how that is hurting workers.
So I'm going to make this really quick and just give a couple of numbers, and then we'll let Dr. Ettlinger get in. So if you look at the 30 jobs that employ the most people in the US that have a high automation risk score, meaning that a machine or a computer could do the job, not necessarily that it does, but that it could. The number one job is cashiers. There are 3.16 or were 3.16 million cashiers in 2019. African Americans and Hispanics are overrepresented in that job. The automation risk score is 97%, meaning that in an 8-hour day, the task that a cashier could do, some type of machine could do 97% of it. Those 30 jobs employ 36,271,000 people. Black people are overrepresented in 11 of them. Hispanic people are overrepresented in those 11 plus 2 more, okay? So if you think about Walmart and Target and other stores, when you went before the pandemic versus now, you notice more automatic checkout machines. Retail salespeople is second, secretaries and administrative assistants, laborers, freight and stock movers. So all of these sorts of industries and businesses that either were shut down or operating at some sort of limited capacity, hours, days, whatever, that have these incredibly high automation risk scores, they could automate during that time. People couldn't be there. They weren't doing as much business because of social distancing. So for companies who had been waiting to automate, that was a perfect time to do it.
Okay. And Professor Ettlinger, please weigh in.
On what? Okay. First of all, one thing just a factual thing. At this point, there are very few people who are getting more unemployment compensation than they had been at their jobs. There was a point when that was, there were a significant number. That's no longer true. So just a clarifying point. I would like to address this idea that unemployment is keeping people from going back to work. There's been lots of research. Historically, unemployment compensation does not keep people out of the workforce. What the evidence shows is that sometimes it does delay it, people re-entering for a short period, but it's actually viewed as a positive because that reflects people spending more time trying to find the better match for their skills, which helps both the employee and the employer and the economy writ large. Now is different because benefits were higher and they reached a broader range of people. But even now, or the period when it was higher, the evidence was pretty strong. But I'm not saying there's nobody out there who wasn't, taking a while to get a job because they were on the benefits. But it clearly is not like the big systemic explanation for what's going on. And it's important to point out that at this point, it's illegal. I mean, if you have to certify, if you're receiving unemployment compensation, that you are looking for a job and you haven't turned down a job. So, again, I'm not saying, people out there probably know people who they think could get a job and that's happening, but it is not like the reason why job growth has been disappointing. And then I have one thing to add on automation, if that fits, which is that, and it's echoing what Dr. Broady said to some extent, but in theory, this actually, you automate, it makes the economy more efficient, and ultimately that ends up creating more jobs. And it's a more complicated story than that because the people, for reasons I won't belabor, but even if you just accept that story that ultimately this is a good thing, you definitely lose the jobs before the new ones get generated because of this more efficient economy. And right now, this happens pretty much in any recession. You get this phenomena, and that just creates a delay in job creation. And so, that's the reason why we need to take steps to kind of accelerate, getting good jobs out there for people to take.
Well, Dr. Broady, do you agree with the first couple of points that Professor Ettlinger made?
I do. So I think that we can say that our people can just transition into these new jobs, right? That there's a labor shortage, that there are all of these companies that are offering higher wages and that are offering bonuses. But if I'm someone who doesn't have internet, how do I know that those jobs exist? If I'm someone who doesn't have transportation, and I live in a walkable neighborhood, I do have transportation, but I could walk around my neighborhood in Baltimore and not see the posting for jobs at Amazon or Target or Walmart or whoever it is that's hiring. Publix, there's not even Publix here. right? So to say that people automatically know that jobs exist, that they're automatically qualified for the jobs that do exist, that they've received a vaccine, that they have childcare, that they have a way to get to the job, just doesn't jive, right? So I think that we need to really look at the people who are not going back to work and figure out why, instead of corporations just saying, hey, we offered more money or we offered bonuses. Is that message getting to people? Right. And if it is, can they get to those jobs and are they qualified for them? Yeah, right? All of those things need to be considered.
You've written extensively about training. Yes, go ahead.
Yeah, sorry. I mean, the other thing is, it's been a year and a half, right? I mean, it's not like people who lost their jobs, people who work at a McDonald's or, low paying, low benefit jobs somewhere, working as a housekeeper at a hotel, have been sitting around anxiously for the last 18 months, waiting for this invitation to come back to their not great job, right? I mean, people have moved on. They've gotten other jobs. They've taken online classes to try to better their situation. It's just gonna, it's just gonna take a while for the people and the jobs to reline up, because it's not like the same people are just waiting to leap back into the same jobs. People have moved on in a number of ways. Sure. So, I just kind of fleshing out a little bit of what Dr. Broady said.
Yeah, absolutely. Now, Professor Faber, what does this all mean for the housing market?
That's a really great question, and not just because I study housing, but so I study the way that housing kind of perpetuates racial inequality, and especially regarding the role of segregation in shaping vulnerability. And we saw that play out quite disastrously throughout the pandemic. That kind of unstable housing that leads to unstable employment, that leads to, as Dr. Broady said, kind of unstable access to transportation, childcare, and other forms of social infrastructure, environmental racism, the concentration of other kind of confounding healthcare environments makes people of color far more vulnerable to not just the direct effects of getting sick and dying from the pandemic, but these kind of second order economic effects. And the housing market, I think, is one place where the kind of hangover, if you will, of this pandemic is really going to be felt, particularly in communities of color. That, again, we discussed earlier how many of us are kind of holding our breath to see what happens with this eviction moratorium, foreclosure moratoria as well. Kind of what's the mismatch on the kind of federal, state, and local levels in terms of those policies? How many people are going to lose their homes? How many people are going to be compelled to move into neighborhoods or housing units that they would prefer not to? How much wealth is destroyed? And it's of course worth noting it. 600,000 people died. That this is a huge loss of community capital as well as financial capital. It's traumatizing. It's going to have spillover effects on people's ability to work. And we know that in the United States, we've intentionally built this culture of home ownership, for better or for worse. And the home equity is the largest asset that most people hold, especially low-income people and people of color. And so these disruptions in the housing market are quite scary from the perspective of racial inequality. And we know that that right now the housing market is on fire in much of the United States. That housing prices are booming. There are negative consequences of that. If you look at the rental market, that the cost of renting was way too high well before the pandemic. We were already in an affordable housing crisis, and this is likely going to exacerbate that. The other thing that we know from prior economic downturns, most notably the Great the Great Recession, is that these periods, again, because they force people to move from their homes, have the effect of increasing segregation. And so this becomes a kind of self-reinforcing cycle where economic and social vulnerability kind of lead you to be kind of more greatly impacted by whatever crisis we're enduring, and then that makes you even more vulnerable to the next crisis. So the neighborhoods that were hit hardest by the subprime lending crisis and the foreclosure crisis are many of the same neighborhoods that are hit hard by COVID-19.
Wow, it doesn't provide a lot of optimism for someone like Tamara Lawrence from our audience, who did ask, the economy is poor, the housing market is skyrocketing. Will the average person be able to afford a home anytime soon? What do you think, Professor Faber?
Where?
Mm-hmm.
I think a lot of people can afford a home in, rural Oklahoma, or downtown Cleveland. But that's not really what the question is. I think that the question is one of, is the average person going to be able to secure financial stability through investment in this financial instrument? And that is a really fraught question, especially looking at the history of racial exclusion from access to homeownership. That we know, I just said that the home equity is the largest asset that people have, especially poor people and people of color. At the same time, homeownership is far more risky for people of color. That home values in communities of color do not appreciate nearly at the same rate as they do in white communities, because of discrimination in the housing market, because of discrimination in the mortgage market, and because of the way that we kind of value communities of color. And so this question of what can I afford? How can I invest in this case, real estate, to secure my financial future, is really hard. I think especially for the generation of Americans who, not just Americans, the generation of people who have now kind of in their early adulthood experienced the two worst economic crises in this country has faced since the Great Depression. So, you mentioned kind of hope and optimism before. I don't hold those things. I think that this is a hard moment.
Can I jump in and just give some numbers to what you were saying?
Broady. Yes.
So I absolutely agree with you. And here's why. So in 2019, 73% of white families compared to 42% of Black families owned a home. So that's first. Black families are not only less likely to own a home, but when they do, those homes are worth less. So the typical white family's home was valued at $230,000 compared to $150,000 for Black families. Similarly, the $30.8 trillion in total real estate assets reported in the second quarter of 2020, white families held 78% of that, or $23.9 trillion compared to 5%, or $1.6 trillion for African Americans. So that's the why to what Dr. Faber was saying.
Okay, well, I definitely know that we have some students in the room now who have joined us. I'm so pleased to welcome them. They're all freshmen at Suffolk University, and they would like to ask our panelists questions. Let's start first with freshman Nayela Lynch.
Thank you, Mabel. My name is Nayula. I'm an incoming freshman at Suffolk University with a major in political science, and my question is for Professor Faber. There is a long history of people of color being pushed into certain neighborhoods in several cities in this country, or as some may call it, institutional marginalization. I know you touched on this earlier, but I'd like you to expand on what you believe will come next in terms of policy response. and what kind of effect this has on those groups who are impacted from this practice, especially since there has been some considerable confusion on the eviction moratorium?
Okay.
This is a really excellent question, and I like it in particular because it elevates two crucial facts. First, that segregation by race and income is a persistent problem in the United States. More than half a century after the civil rights era, and this segregation is not the result of any natural processes, but was the intentional result of racist government policy like redlining, zoning, racial covenants, as well as practices of mortgage lenders, real estate agents, and other private actors in the market. And there's just a tremendous amount of evidence showing that segregation drives inequality by kind of similar to the things that I said before, kind of making it harder to get a job, build wealth, access quality housing. And these and many other factors made people of color more likely to get sick and die from COVID or lose their jobs, and make it more difficult to access government assistance. And they're now facing this higher risk of eviction and foreclosure. And so I am quite worried, honestly, about what the kind of long-term impact of this pandemic is going to be in terms of housing outcomes like home ownership and home equity, and the policy levers that are being discussed now, moratoria, which are important, rental assistance, which is important, mortgage assistance, which is important. None of this is one, sufficient, or two, kind of targeted at the most vulnerable communities, and those kinds of policies are not being discussed right now. So it's hard to speak to what the policy's response will be when the appropriate policies are not being discussed.
Okay, thank you for that, Professor Faber and Nayela. Let's go to Zachary Rodriguez, also a rising freshman. Go ahead, Zachary.
Thank you, Mabel. My name is Zachary, and I'm an incoming freshman at Suffolk University, and I will be majoring in law. My question is for Professor Ettlinger. Since the pandemic started in 2020, the United States government issued stimulus checks to support millions of American families, along with an implementation of policies to provide assistance in response to COVID. I was curious to know what the long-lasting effects of the stimulus checks will be, considering the disruptive economy we've seen within the past year.
You'd think I'd be ready to unmute at this point. Yeah, so I sort of talked about the immediate impact, which I think was very important. And I think, whatever, weaknesses are in the economy now, we'd be in a lot worse shape if those hadn't happened, not to mention all the sort of, destruction and devastation people and businesses would have experienced had it not been for that money. Going forward, I do think it puts us in a lot stronger position than we would have otherwise been, for all the reasons I've said. I mean, I probably shouldn't say anything about the housing market with Professor Faber here, but we would be seeing massive foreclosures. I mean, it would be, that we would be seeing, it just would have been, we'd be in a way worse situation had not those interventions taken place. And in terms of going forward, people are in, many more people are in a decent sort of financial situation emerging from this than otherwise they would have been. And so, people, when restaurants open, more people can go out and eat in them than would have been true if it hadn't been for all that assistance, right? And it's those things that sort of get the spiral that happens in a recession going up instead of down. People go out, they eat, the restaurant employs people, those are more people who have income, it's just like they buy other things. And what we need is an upward spiral instead of the downward spiral you typically see in a recession. So like the short version of what I just said is all of that money kind of arrested the downward spiral of people losing their jobs and not having any money. So more people lose their jobs and not having, and will help us in the spiral back up. So.
Okay. Thank you for that, Professor Ettlinger. Janet Richardson is also a rising freshman. Go ahead, Janet.
Thank you, Mabel. My name is Janet, and I'm an incoming freshman at Suffolk University, majoring in political science. My question is for Dr. Broady. The foreclosure moratorium was recently extended. When the moratorium ends on October 3rd, do you think there will be mass evictions on the rise like the news has indicated, or do you think another solution will be found?
So I think it depends. And I know that's never the right answer, but I think that with the Delta variant and the Delta Plus variant, and who knows what's going to happen after that, right? I think that if we can get these variants under control and people are vaccinated, then maybe people can get back to work and there won't be another extension. But I think so long as we keep seeing these variants, especially as it gets colder and people can't do as much outside, that you're going to have extensions, right? The government is saying that we can't keep doing this, but they can't have the alternative either, which is people getting evicted, period, let alone in the wintertime.
Okay. All right. And thank you for that. We also have our final question from Khadija Hussein, also a freshman at Suffolk.
Thank you, Mabel. I'm Khadija. I'm an incoming freshman at Suffolk University, and I'm majoring in political science. My question is for you, Mabel. With your background of healthcare news reporting, do you believe the concerns and suspensions of Johnson & Johnson and AstraZeneca have caused hesitancy within many different communities? How harmful is this issue? How much of an impact does it have on our ability to be able to have a fully vaccinated nation?
Well, thank you. Thank you so much for that. I mean, COVID certainly kept a lot of reporters extremely busy this year, especially healthcare reporters. It was like the gift that just kept on giving in the worst way. Now, the pausing of the AstraZeneca shots and the temporary pause on the Johnson & Johnson vaccine certainly didn't help the PR surrounding the vaccinations. And in the case of J&J, if you look deeper back in April, it was just 6 cases of the rare blood clot side effect, 6 out of the millions of vaccinations that had already happened. Certainly, there are a lot of reasons, legitimate reasons why some people may be hesitant to get their COVID shot, fear about the incredible speediness of the vaccine development, fear about misinformation, fear from the distrust of government authorities. I get it. I get it. But according to Dr. Anthony Fauci, whom I interviewed last winter, vaccinations are the very best tool we have to get back to the degree of normalcy that we all crave. And back then, when I spoke with him, we needed 70% vaccinated to achieve herd immunity. That's the point where enough people are immunized that even unvaccinated people are protected from infection. But as long as there are unvaccinated people around, and there are a lot, the virus will continue spreading and finding safe harbor to mutate to spread to more hosts. And we're already seeing that with the Delta variant that is more contagious, has more viral load, and is speeding its way through our communities now. Now, consider this. Someone infected with the original COVID strain could be expected to infect 2 to 3 more people. But people infected with the Delta variant are passing it on to at least 6 people. That alarming data means the US will likely need even more individuals to get vaccinated to reach herd immunity. And I've heard from experts just this week that that's pushing that threshold up to 80, even 90%. So, the ongoing hesitancy to get vaccinated will only drag out the pandemic and make it more difficult to resume life in the way we all want to. We have a question from our audience who asks about the supply chain. We saw a shortage of almost everything. was that a function of the supply chain being disrupted or something more? Why did we suddenly not have enough toilet paper? Do you want to take that first, Professor Ettlinger?
There were a number of reasons, and there are a number of things going on now. I mean, one was just there was a pandemic, and factories closed, and shipping was disrupted, and all of that. There was also hoarding. I don't know why everybody, when something bad happens, buys. I mean, we don't want to do without toilet paper. I get that, but it's like what happens is everybody goes out and buys tons of toilet paper, and there's shortages. So, I mean, I have no idea if there were other things going on, but that definitely was happening. And to some extent, we're seeing actually that now on the sort of industrial level, that companies are over ordering inventory because there's such barriers, because there's shipping problems right now, just because the economy is like surging back and there's this massive increase in purchasing. And so companies are over ordering things to make sure they don't run out, which is exacerbating the problem of shortages. So, and then there are other things that happened that were are byproducts of what happened of reactions of businesses to the pandemic. So for instance, the automobile industry, thought, oh my God, we're not going to sell any cars. They drastically cut production, and they stopped ordering from so they cut back on their orders from their suppliers. Mm-hmm. And they sort of created their own supply chain problem, specifically in chips. Like all these chip manufacturers said, okay, car industry doesn't want us. We're going to make, camera doorbells or something. And so now the automobile industry is going back as, hey, now we want to increase our orders. And they're like, well, we're making camera doorbells and we're making lots of money at it. So some of these supply chain things are, there's lots going on with that. Some of it is the pandemic still, doing it. Some of the stuff like what I said in the auto industry, some of it's panic buying. I mean, and some of it's just the surge of demand, which the system is not able to all of a sudden, meet. So there's a lot going on. I mean, my view is it's gonna, it'll work itself out. Like, call me a capitalist, but this, supply and demand kind of does straighten itself out on this sort of thing eventually.
Well, it sure is testing the just-in-time manufacturing school of a thought, right? Now, what about this next question we have from the audience? Some argue that while individual unemployment benefits should be discontinued, benefits for businesses should remain. What are the pros and cons to this approach? Dr. Broady, you want to take a stab at that?
Yes, so I think ultimately that sounds like trickle down economics of one kind or another, right? So we've seen states get stimulus money and not give it to their residents for rental assistance. So giving money to companies, what's to say that the companies hire people back instead of buying machines, right? When we look at an investment in capital versus labor, how do we make sure that they invest in people? Where I think if you give the money to the people, then the people can use it to buy groceries, to pay bills, to take care of their children, and do the things that they need to do instead of adding an extra step or a middleman.
Okay, well, this is in your wheelhouse, Dr. Broady, because our next question is, as we automate, what role does new job training play? Should we shift the paradigm from the types of low-skilled jobs that we see in retail to more sophisticated roles to support the new automation and the next generation of blue-collar work?
I think that we need both. So just because, for instance, the cashier job has an automation risk score of 0.97 does not mean that 97% of the cashier jobs are going away. I think some people have argued with me about that, and it's like, that's not what I'm saying at all, right? So I think that just because a job can be automated doesn't mean that it's going to be. Labor has a cost, but capital does too, right? So going to automation, there's a significant cost to it. So I think that the best thing is for companies to share information on their plans. How many people do they plan to hire, when, and what skills are required? Share that information with 2-year schools, 4-year schools, tech schools, and any other place that does training, so that training institutions know what they're preparing people for. And some of that could be funded by the federal government, some of it could be funded by corporations, foundations, etc. But I think it's that bridge building and pipeline building so that training institutions know what to prepare people for. And once they are prepared, jobs do exist, whether that's for students entering undergrad for the first time, or workers who have been working for however long that may need some type of retraining.
Okay.
Can I jump in on this quickly?
Yes, and the next one is for you too, Professor.
Oh, sure.
Go ahead. Yeah. Go ahead.
Well, do you want to? Okay, I'll just. You know, I completely agree with everything Kristen just said. I just wanted to make two kind of parallel points. The first is that I think we have to reconsider what a good job is. And you know, if you think back 100 years ago, manufacturing jobs were the worst jobs you could get. And, you know, it was through unionization and policy fights that benefited laborers that those jobs became these, you know, magnificent pathways to the middle class and homeownership, particularly for people without college degrees. And there's nothing to say that, you know, today's service industry jobs couldn't undergo that same transformation through unionization. And we know that unionization and the decline in unionization has had these enormous consequences for income inequality. The second point is kind of more about the long-term consequences of automation. Again, I completely agree with Kristen that, you know, 97% of these jobs are not going to disappear. But you know, there are fundamental ways in which the world of work is changing, and you know, this is especially true for vulnerable populations. And you know, employment is going to become more sporadic, and you know, wages haven't kept up with inflation for half a century, and there's no reason to believe that they will start. And so, you know, policy solutions like, you know, if you want to call it a universal basic income or a wage floor, are going to be absolutely essential to kind of avoid catastrophe.
What's a proven method of increasing home ownership in people within communities of color? Someone from the audience asked that, but have you studied that, Professor Faber, that there is a way to really get people involved in that process and have some success there?
Yeah, so you know, in response to the Great Depression, the federal government passed a suite of enormous housing programs. You know, billions of dollars investing in housing. They invented this financial instrument that didn't exist before, which was the long-term 20 or 30-year fixed payment mortgage. Again, that did not exist before the Homeowners Loan Corporation, the Federal Housing Administration, and the GI Bill institutionalized and nationalized and created a kind of insurance program for these policies. And these policies lifted tens of millions of Americans into homeownership. That homeownership went from around 40% before the Great Depression and the New Deal to around 65% by 1970. So these programs were incredibly successful at creating homeownership opportunities. The problem was that they were explicitly racist, that they, in their documentation, excluded people and communities of color, thereby increasing segregation and creating the foundation for the racial wealth gap that we see today. And in what I imagine is the kind of underlying point of this audience question. And you know, I think that the good news about all of this is that we know what we did to create this inequality. We simply paid these people to buy homes, and we didn't pay these people to buy homes. And so, you know, creating these affordable, stable, ubiquitous methods for investing in wealth accumulation is, it's not a mystery. I think that there are far more complicated questions related to what I mentioned earlier about the risks of homeownership, about whether homeownership can close the racial wealth gap. I am a pretty strong believer that it cannot, because of the kind of racist nature of the housing market, that home equity accumulation is a way riskier prospect for people of color, and there are kind of other ways of addressing the racial wealth gap.
Well, I liked how you said there was some good news in there, because it was looking and sounding kind of grim. So I'm glad that there are some things that we can look to that are positive, very positive. I want to turn it over to Professor Ettlinger for a bit, because we have learned a lot during this period, during this pandemic. We are on some type of economic recovery. What are the primary things that could hold back the trajectory that we're seeing now?
Well, I mean, I think number one is COVID. Obviously, if the situation gets worse, that's and it's holding us back now. Just to be clear, people are still sick. People are still have legitimate fears, and so they're not resuming all their economic activities, and people are traumatized. So it's already that. So that's one. I'll be quick because we've sort of touched on these things, but kind of the barriers to reattaching to the workforce, that's going to take a while to sort out. I think Dr. Broady, was the one who mentioned, sort of like childcare and dependent care issues. Caregivers are not going to go back to work if they don't have someone to care for whoever they're caring for. So, I think that's something. And we touched on how businesses are sort of making themselves more efficient, but which often means employing fewer people, and that's something that's going to slow us up. I also think something we haven't mentioned is closed businesses. There, a lot of, a block within the square block around me, there's at least 3 storefronts where there used to be restaurants. And in 2 of them, there are signs, one that a donut shop, which I'm looking forward to, is going to open, but it's like, it doesn't happen like that, right? So, some of this is that. And then there's the supply chain stuff that we discussed. I won't belabor that. So I think there's a lot to work through. But I also think we're not doomed necessarily. Like, a lot of this is there's things that aren't under control, but there's also a lot that is under our control. And, if the government sort of makes the kind of interventions that it should and starts doing things to accelerate employment.
Like what?
Growth. Well, I think, some of it is like targeted stuff to address specific problems, businesses and challenges. Like, obvious example is childcare, which was we had a problem with the adequacy of the supply of quality childcare, but it got way worse now. And, so, there are efforts to address that, and addressing that would help. But I also there's a whole lot of things we need to do in this country. Physical infrastructure has been getting a ton of attention, but there's human infrastructure, there's clean energy. There's a ton of things we need to do. And now's a really good time to do them, because it'll, if you start doing those things, that employs people, it builds to a stronger economy for the future. So those are things that we should be doing. And I just want to echo also both of my fellow panelists, equity is actually a really important economic growth issue, right? It's an incredibly important kind of moral issue, but it's also a growth issue. And it's also, the fact that people have sort of been shackled and literally in the past, and to some extent now, but certainly figuratively, and prevented from fully participating and contributing their talents to the economy hurts everybody, And I could go on about this, but I just that's another really important thing, that both addressing that helps in the short term because it's those populations that are being as others have said, been particularly hurt and are facing a particular challenges in getting back, but it also is important for the long run.
Yeah, would you agree with Professor Ettlinger's priorities and what he said about the policies that need to be in place? Do you want to take that, Professor Faber?
Sure. Yes, I do agree. Yeah, I'll leave it. I'll leave it at that.
Okay.
Dr. Broady.
Short and sweet.
Yeah.
Dr. Broady, how about you?
So I think that one of the biggest problems, and this is going to be it could be my answer to everything, is racism. And the reason I say that is because of racism, we have this inequity in healthcare and housing and all of these other things, right? And so the people who are in charge, many of them care more about their own people than the people who they don't consider their own. Second thing is the politics of misinformation. And certain news agencies and certain political figures and certain political leaders and former political leaders put out misinformation about the numbers in terms of COVID, about the vaccine, about what needed to be done. Many of these people got vaccinated and still convinced other people not to, right? Like people would say that, the former president or some, congressperson or senator convinced them, or because of something that person said, they're not getting vaccinated, or they have a right not to get vaccinated, or the vaccination isn't real, or, all of these things. And it's like the people who they heard that message from originally are vaccinated.
Yeah.
Right.
Well, the message
and I think just the fact that in the beginning, I remember hearing this rhetoric that Black people weren't getting COVID, right? That it started in China, and that when it came here, it was mostly white people that were getting it. That kind of reflects what happens with the HIV crisis, right? In the beginning, they said it was a disease of white gay men, but ultimately a higher proportion of Black people ended up getting it. Same thing with COVID, not the number, but the proportion, right? So I think all of these things, racism and the politics of discrimination and of misinformation, is a huge part of the problem. If people had real information in the beginning about the pandemic, about the vaccine, then more people would have gotten vaccinated, just like with chickenpox or polio or any of these other things, right? I mean, I think, and I'll just use this example, but it's like if you've ever had a gyro, like what exactly is in that, right? Or if you've ever bought medication from a gas station, or there are a lot of things that people ingest and consume that they have less information about than this vaccine.
Absolutely. Now, what do you think are some of the things that we've learned that will stick post-COVID, whenever that is? Because that's absolutely, we're just not certain when we're going to return to the life as we used to know it. But what are some of the things that you think will stick? You want to take that first, Professor Ettlinger?
Okay. Well, one thing I hope this builds on what Dr. Broady was saying, which is, people are starting to get the message that maybe they should get vaccinated when enough people are dying in their communities that aren't getting vaccinated. So I'm hoping that sticks, that when the entire medical profession says you should do something, they're not always right, but, they're probably right and they should probably do it. It's easy to be pessimistic because you can look at history and say, well, we didn't learn the lesson last time. Why are we going to do it? But it's more, I'm less going to predict, I guess, what's going to stick and say what I hope is going to stick. And I referenced the automatic stabilizers before. I do hope, and there are people in the Biden administration who frankly are acutely aware of this, and people, and like we've had these two, the Great Recession was the biggest recession since the Great Depression. And now we have this, which is even bigger. So you have sort of a generation of policy people who've seen this up close. And just like after the Great Depression, which was unprecedented at that time, you saw a lot of good reforms that we're still benefiting from after that. My hope is that we now have a generation of people who've been through this twice, and that they're like, you know what? We need to do things to make our economy more resilient when things go bad. We need to do something about our economy that isn't like heads I win, tails you lose kind of economy, where it's sort of always the people in the lower strata, socioeconomic strata that always get, economy goes great, they fall farther behind. Economy crashes, they fall farther behind. It's like, yeah. and I do think we do have a generation of people now who've really seen that much more starkly than you really saw in the generation before. And so my hope is that lesson sticks much more than it has in the sort of milder, less stark times that kind of preceded the Great Recession.
Okay, well, it looks like we are at the end of our discussion. And I just wanted to thank all of you for being here. Everyone who typed in questions, and also our students. And I had a great time, learned so much. I hope you guys did too. I want to hand it back now to Christina.
Thank you, Mabel, and thank you to all of our panelists. What a great discussion that we had tonight. It is a huge topic, and of course we can't get to everything, but I think one of the important things that I want my students and people in the audience to take away is the idea that the COVID pandemic is likely to be an inflection point, right? We are living through something that we'll have to be figuring out for years. But that's what social scientists do, right? So we want to know the before and the after, but we're also, it's hard to call it the privilege, but we are living through it, we're experiencing it. And I think that can't really be overstated. So these are really, really important issues for everyone to understand and to think about the intersection of how we act in our lives and how the world around us acts on us. So that's not just politics, it's policy. So understanding what the impact on the ground is and what we can do about it or should do about it, those are loaded terms, right? That's part, I think, of a message that we should be sending, particularly to our incoming freshmen, that this is the world they're going to inherit. They have a stake in it, and they have a say, and they have a voice. So they need the tools to be able to understand and to influence policy directions in the ways that they want the world to be before we reach the next inflection point. So I tried to sound a kind of optimistic note there. I know there's a lot of stuff going on, there's a lot of pain, but we always try to end on a slightly optimistic note at least. So once again, thank you so much for joining us tonight.